Dr. Raymer comes up with some fantastic speaker that we need to schedule. Otherwise, we'll probably be back in August. These lectures are a cooperative with the Office of the President, the Office of Health Policy and Legislative Affairs, and today's is with our good partner, Dr. Ken Ottenbacher, and the Center for Rehabilitation Research using large data sets. So I'm going to bring up Dr. Ottenbacher to present our speaker, and thank you again for being here.
Well, thank you, Becky, and good afternoon, everyone. As Becky said, I'm Ken Ottenbacher. I'm a faculty member in the School of Health Professions. And I'm delighted this afternoon to welcome Dr. George Alter to UTMB. Dr. Alter will present a lecture titled Lowering the Barriers to Data Sharing, ICPSR and BioCADI. And I'm going to let him explain what ICPSR is. We in the scientific world are on the precipice of a revolution in archiving and data sharing. Many investigators in the biomedical research community may not be aware of the revolution, but it is coming. The revolution started in 2013 when the White House Office of Science and Technology Policy published a report entitled Increasing Awareness of the Results of Federally Funded Scientific Research. The report includes a mandate that agencies develop procedures to make the results of federally funded research available to the public, to industry, and to the scientific community. In January 2015, the Institute of Medicine released a report including recommendations and requirements for archiving and sharing clinical data. In February and March of 2015, the Agency of Healthcare Research and Quality and the National Institutes of Mental Health published requirements for archiving and data sharing. The requirements include detailed data sharing plans and future grants that will be scored by reviewers. So data sharing may be new to many in the biomedical and clinical investigators, but not to Dr. Alter. Dr. Alter has extensive experience and expertise in this area in his role as director of the ICPSR at the University of Michigan in Ann Arbor. The ICPSR is an international consortium of more than 700 academic institutions and research organizations involved in archiving and sharing research data. The ICPSR maintains a data archive of more than 500,000 files. Dr. Alter holds BA, MA, and PhD degrees in history and economics from the University of Pennsylvania and the University of Michigan. In addition to his research related to data sharing, Dr. Alter's scholarly interests include the history of the family, demography, and economic history. He is the author of numerous articles and reviews and a frequent presenter at national and international meetings. Dr. Alter has received extensive funding from a variety of sources, including the NIH, the Sloan Foundation, the Bill and Melinda Gates Foundation, and the National Science Foundation. Please join me in welcoming Dr. Alter to UTMB.
Thank you. It's a real pleasure to be here. Ken didn't mention that we've started working with Ken and his center and on a project to archive data related to disability and rehabilitation, and we're just delighted to make this connection, and it's been great to meet some of the colleagues here. So I'm going to talk about two projects, or two groups. One is the BioCADI project, and the second one is ICPSR. So there really will be two different parts to my talk today. So I'm going to start by talking about BioCADI. BioCADI, there we go. So BioCADI is a project that is part of the NIH Big Data to Knowledge program, known as BD2K. And it comes out of a report that was done for the director of NIH by an advisory committee on big data. And one of the recommendations in the report was that NIH should move decisively to create a way to disseminate and integrate the many kinds of data that are used in biomedical research. And in particular, they said that to promote data sharing, NIH should create what in the report is called a data catalog, but after a subsequent meeting at NIH is now called a data discovery index, where there would be one place that people doing biomedical research could come to find data that would be relevant to the research that they're doing, and where all of the data that's being generated by the many NIH research projects could be found. So this is actually the list of things that the NIH BD2K is supposed to do, and they're supposed to enable using big data, analysis methods, and software. And let's see. There we go. So BioCaddy is right here. This is we're number 2 on the list, and that's to create this catalog of research data sets and in ways that people can find them. There we go. So here are the main goals of BioCaddy. The main goals of BioCaddy are to index data sets across all of the biomedical data repositories, to create ways to help users find the data that they need, and also, when they find the data, to tell them about some of the access conditions. Is this freely available? Do you have to have a data use agreement? And so on. But also, in order to do that, I think that all of us involved in the project realize that a lot of it is going to involve creating incentives, creating standards, so that we encourage people to do data sharing. We incentivize data curation and annotation and documentation, data use, and also incentivize better data citation, so that we can create the links between the data sets and the publications that result from them, which is very important. So the outcomes of the BioCaddy project are, we are actually charged to come up with a prototype of a data discovery index, something that will actually work. It's intended to be an open design so that additional modules can be added to it to do more specific things. Are intended, and actually we want to serve as a kind of an incubator to try out innovative designs. There are some things built into our work plan where we're going to try some things. There's one in particular that I don't think will work, but there are enough smart people who think it might work that we ought to try it. And if it doesn't work, it doesn't work. But if it works, it could be really cool. And also, we're charged with liaising with the NIH Commons, which is under development, so that objects that are in the NIH Commons will be indexed in the Data Discovery Index. So the NIH Commons is another part of BD2K that is conceived of as an environment where people can store and manipulate research objects. I think it is motivated by several different concerns. One concern is the growing need for places where people can work with really big data sets, like major genomic data sets, where you need lots of computing power, but also that while there are now hundreds of different databases and repositories in the biomedical world, there are lots of things that don't have a logical place to go, and that what's called the long tail of science would have a default home in the NIH Commons. And this is something that, as far as I know, is still a concept and not a place, but we're charged with with helping that to develop. So one of the things we've been doing is trying to come up with use cases. What will the Data Discovery Index do? And in our work plan, we talk about these 5 use cases where a researcher would come to the BioCaddy index and ask for, all data sets from an Alzheimer's patients who have a certain RNA sequence. There's another one about proteomics and metabolomics, which I freely confess I still don't understand the difference. And then at the last one there is one more in our wheelhouse about, are there data sets where you can look at the effect of stress and maybe on health and maybe break down different kinds of stress and so on. So these are the kinds of questions that we think a researcher would come to the Data Discovery Index with that we want to be able to answer. And the answers that we will present will be data sets. They won't be, here's the answer, to the question. It'll be, here's a data set that you can use to find the answer. So this is a sort of conceptual idea of the space that we believe we're operating in. And we're operating in a space that's already occupied by a lot of stuff. So our idea is that down here, these things are data sets. And these data sets sometimes are in repositories. Sometimes they're not in repositories. So we've conceived of there being a level of data sets and then already services that are out there. So a repository like ICPSR would be one of these things that we call an aggregator. But another aggregator that's involved in the project is the Neuroscience Information Framework. And they actually don't keep the data themselves. What they do is they index several hundred other places where you find the data. So these white things are supposed to be metadata, the descriptions of the data. And the problem we face is we've got all sorts of things out here, all of them with different kinds of metadata. Then some of them have been already aggregated, and ultimately we want to have we will have our own metadata schema that will go across all of these things and will allow people to do discovery at a very high level and then find their way down so that they get to the data. So how we will do that, I have some ideas, but we're at the beginning of a project to actually make this work. This is the list of working groups we're in the process of setting up to solve some of these problems. We need working groups to talk about metadata, about data identifiers, and data citation metrics, and things like that. So you can see we have a lot of work to do, and we have only 2.5 years to do it. So we're going to be running really fast. These are the people involved. The PI of the project is Lucila Ono Machado, who's in the Division of Bioinformatics at University of California, San Diego. And you see this is our sort of executive committee, and some of you may know Hua Zhu, who's at UTH, which I visited yesterday. And Hua actually has one of the hardest jobs is we have to build a prototype, and he's in charge of building that. So I don't envy him that part of the project. So I think that's my last slide about BioCaddy, and I'm going to switch over to talking about ICPSR. But if anybody has a question about BioCaddy, I'll be happy to try to answer it. It is still a project that's at its beginnings, but we have high ambitions. Okay. Well, let me talk about ICPSR. I've got more ICPSR slides, and if something comes up about BioCaddy, I'm happy to answer it. So this is our the ICPSR mission. Our mission is to act as stewards for data from the social and behavioral sciences, to make sure that those data are available to future generations, and also to provide education in the use of those data. So these are the key things that we actually do. We acquire data from researchers who have collected it for research. We redistribute those data to other researchers so they can produce new science with it. We preserve the data for future generations, and we provide training in quantitative methods. Our founders were very, recognized very early that if they were going to provide all this data, they also needed to provide a way for people to learn how to use it. Let's see, where am I supposed to be clicking on here? Okay, so this is, yeah. So this is a little bit about our history. We were founded in 1962. Our founder was one of the scientists involved in the American National Election Study, which actually started in 1948, and it has continued since then. And he wanted he was a political scientist, he wanted other political scientists to be able to use that data and other data. And so he traveled around the country signing up universities to be members of this new consortium. And when he started, we were distributing data on punch cards. And then for many years, we used 9-track tapes. So ICPSR, for most of its existence, had a shipping department, because these things all had to be shipped out to different universities. But about 12 years ago, we got out of the shipping business, and now things are all direct download, except for some restricted use data. So this is what our website looks like now. We have currently more than 760 members worldwide, about 400 in the United States. Our members are institutions, so most of them are universities. We have some research organizations. And the data are available online and for download. A little bit about our governance. We report to a council that is actually elected by the membership. We have constitution and bylaws. And ICPSR has a kind of a dual existence where we belong to the members, because we're a consortium, but we're at the University of Michigan, and there's a memorandum of understanding between the council and the university that says that the university operates ICPSR for the benefit of the members, and we report to the council for things. One of the things that grew out of our need to ship boxes of cards to members is that to make that process easier, we have a system of what we call official representatives. So the official representative was the person who went on who we shipped the cards or the tapes to. We don't do that anymore, but we still maintain ties to our official representatives, who have now become sort of our eyes and ears on all of our 750 institutions. And now more than half of the ORs are actually data librarians. They're in a university library, and they're responsible for advising faculty and students about data. And they're actually a really terrific group. We have a meeting every second year where we get them together and talk about what we're doing, but usually the best thing at the meeting is they find each other. And I've heard them, I've been in the hallways where heard people say, well, my supervisor just said I had to do this data thing, and I thought I was the only one, and here I come, and there's all these other people who do the same thing. It's actually a great experience. In addition to the data that we archive for the membership, We also archive data for sponsors. We have currently about, on the order of about 20 different sponsors, 3 different institutes in NIH. Hopefully we'll get to 4 soon. And different places in NSF, Gates, the NCAA, and so on. And for many of these sponsors, we create what we call a sponsored archive on a particular subject. These are our largest sponsored archives. And what we do for those sponsors is we create a web presence. There's usually a portal where people can find data. Depending upon the sponsor, we have more or less functions there. Some of our sponsors have information that they're constantly putting out, so we have weblogs and things like that. Other sponsors, it's more basic, but we have them across all different fields, and a lot of them are in health-related fields. So we have an archive of data about aging. We have an archive of data about demography and population. We have an archive, we actually have 2 archives that are related to substance abuse, and we have the archive over here, Health and Medical Care, is one that's funded by the Robert Wood Johnson Foundation. In addition to those models, our model of the data that we archive for the members and the data we archive for sponsors, because of the requirement now in the federal agencies that people who get grants have to make their data available to the public, we created a different mechanism for that called OpenICPSR, which is a self-archiving mechanism. And so anybody, well, not anybody, but individuals, researchers can come and use OpenICPSR. They put it's a self-deposit system, and we've made this available as a benefit of membership. So if you're at a member institution and you have to comply with something for NIH or NSF where you make your data available, you can put it there yourself. We do not provide curation to OpenICPSR except if we're paid for it, and I'll tell you more about what curation means. But one thing that's different at OpenICPSR from other systems that do this, like Dryad or Dataverse or Figshare, is that we will actually accept confidential data, and we will distribute it to users under a data use agreement and with proper security. So we're willing to take that on. So let me talk a little bit about confidential data, since I know that's a topic very much on the minds of some people here. At ICPSR, we've been dealing with this now for many years, and it's not just in the biomedical sciences that we have this problem. When surveys are taken in social sciences, we promise subjects that we aren't going to tell, their names are not going to get out, and people won't be able to identify them in the data. That's becoming much more difficult to handle because both because of the spread of information on the internet, but also because of the way that social scientists are creating data sets now. People now put georeferences in their data. They do longitudinal studies where they interview people multiple times over a span of years. Many of our data sets are data sets that are about institutions like schools or clinics for drug rehabilitation or things like that, where the information actually first can identify the institution, and once you know that, it becomes easier to identify the people. So we've had to spend more time in dealing with how do we share data where there are confidentiality issues. And there are a number of things that we do. So first of all, we have internal procedures that are part of our data processing where we try to eliminate some of the easy things to get rid of. So the first thing is that we don't really accept data that have direct identifiers, names, social security numbers, phone numbers. There's no reason why we're taking data for reuse. There's no reason why a researcher would need that information. So part of our process is we look for those things and make sure they're not there. We try to evaluate the risk of deductive disclosure. Deductive disclosure means that you don't have a name, but you know enough about the person because of the questions they've asked, like you know that this is a female Hispanic judge in Alaska. There probably aren't too many of those. You can identify them from the characteristics. So we try to detect whether there's a problem there, and then we use appropriate data distribution procedures that are gauged to that kind of problem. And we have a number of things that we do. We use restricted use agreements, or I get the biomedical world is the word is limited use, isn't it? Right. So we use an agreement between between us and the data user that obligates them to protect the data. We have a data enclave, which is a locked room in our basement that has a computer that's not connected to the internet. For very highly sensitive data, you have to go there, and we go through your pockets before you go in, and we go through your pockets after you come out to make sure you don't take anything out that's not allowed. And we have another a new system called a virtual data enclave, which does much the same thing but works on the basis of technology. And what we try to do is to apply the least restrictive conditions to data use that meet the requirements of the need to protect confidentiality. And to do that, when I think about the risk of disclosure, that is, say, the risk that something bad will happen to a subject because of the information they gave us, I think of it varying along two dimensions. One dimension is what's the probability that someone could take the information in the data set and re-identify an individual. So if you're dealing with a data set that's like a CBS News poll, of which we have hundreds, where they did random telephone dialing across the whole U.S., and the only information they collected about people was, sex and age, and then they asked them, what refrigerators they buy and who they're going to vote for in the election, the chances that you can identify someone are very low. The other dimension that's important is, let's see, so I want to be over here, is this dimension, the severity of harm. So suppose that someone is identified. Well, what kinds of bad things might happen to them if the information got out? Well, if they were asked about their political preferences or what kind of toothpaste they use, probably not much. But if they were asked about health, which is important, they could fear that their insurer might do something. Or we have a number of surveys that ask teenagers about their drug use and sexual behaviors. Those are things that we told them their parents wouldn't find out about. And we have other kinds of things that could really lead to harm. So when you put these two dimensions together, they set up a kind of a gradient of risk. At the low end are data sets that are very anonymous because there's not much in them that can lead to re-identification, and where the questions are not very harmful if they got out. And for those things, we put them up on our website, and anybody can download. Most of our stuff is actually in that category. Then we get things where, because there are more questions involved, it's easier to identify people, but still the questions are not lead to mild embarrassment perhaps, but not real damage to reputation. In those cases, we will often put in some kind of data use agreement, but we'll usually send the data out on a CD so people can use it. Then we get to things where some harm might actually occur. These are more complex studies, studies that have individual where there's information about perhaps sexual behavior or things like that. In these things, we're now using a stronger data use agreement that has more rules about what you can and cannot do, and we're beginning to use technology like the virtual data enclave, which I'll come back to in a minute. And then there's the stuff that's really radioactive. We have some surveys. The one that we have right now that is the most sensitive, I think, is we have a survey that interviewed prisoners who had been raped in prison. And as you can imagine, that is off the charts in both of my dimensions. You know, it's very easy to identify people because they give information that could lead to identifying which prison they're in and things like that. And of course, it's extremely sensitive material. So that's an example of a data set that can only be used in our physical enclave. You have to come to Ann Arbor and work in our basement. There are not very many things in that category, but that's an example of one that is. So this is the kind of what we've been trying to do is develop a number of different ways to distribute confidential data so that we can gauge the restrictions to the problems in the data set itself and not apply the same level of restriction to everything. So this is a picture of the virtual data enclave. It's when you actually see it, it's not that exciting. But what's going on here is this. So this black is my normal Windows desktop on my computer. And what I've done is opened up a window on there using client software that we use from VMware. There are two main companies that do this, VMware and Citrix. And what happens here is inside this window, there's another Microsoft Windows environment here. And we've populated it with all sorts of statistical software. You can save things inside the virtual enclave. When people have to sign a data use agreement, once they do that, we set up folders for them inside the enclave that has the data that they've requested. They can use Stata or SAS or SPSS or M+, and a whole bunch of other things inside there. But they cannot save things from here onto their regular computer. So they can't save to their hard disk. They can't print. They can't go to a USB port. They can do a bitmap copy. That is to say, they can take a picture of the screen, which they could do with their cell phone too. But they can't do a copy and paste where that would change the information. So, you know, if you couldn't do a copy from this into a Word document because it would show up as a picture, not as text. So there are some things that we still need a data use agreement because there are some things that you can't do, but there are a number of really important advantages to doing things this way. First of all, the data don't get out. The data stay on our servers in Ann Arbor. If somebody does something wrong or they come to the end of their contract, we just switch them off. And secondly, actually, while users like to have the data on their own machine, ultimately I think people will realize that there's a lot of rigmarole to getting confidential data that they don't have to go through. So data protection plans to get confidential data can run for 20 or 30 pages, and they require you to do all sorts of things. They require you to have your machine not connected, and you can some of them say you can put it on an external hard drive, but it has to be bigger than a bread box. You can do this, you can do that. They're a nuisance for us. They're a nuisance for the users. The data protection plan for using the virtual enclave is close your door. You're not allowed to show it to anybody else. It's a lot easier for us to deal with. So let me talk a little bit more about what it means to be a data archive and what the things that we do, what we really do. So one thing it means to us is that a repository is an archive is a memory institution. When people give us their data, we're making a promise that it's going to be around for a long time. We still have all of the data that we collected since 1962, and it's still available. That means that we have to do preservation. And preservation means more than just doing backup. For one thing, when we do backup, we really do backup. So we don't just make one copy of things, we make 6 copies. And 2 of those copies are in Ann Arbor, and 4 of them are distributed around other places around the country, so that if a tornado comes through and hits the University of Michigan, we're still there. It also means that with digital things, you can't just put it in a closet and expect it to be there in 5 years. So our policy is actually to have the data on spinning disk so that periodically it can be checked to see that nothing went wrong. That's more than just putting a CD somewhere. Another aspect of preservation is metadata. So metadata is documentation, data about data. Why do you need metadata? Well, my standard for metadata is that a researcher 50 years from now should be able to open up the code book and use the data when there's nobody left alive who created the data who can answer questions. So metadata is actually an important part of data, of preserving data, because you have to preserve the information, the documentation with it. And of course, metadata is also important for data discovery. You need to be able to, for people to use the data, they have to be able to find it. So you need to have a description that they can find. ICPSR was one of the founders of an organization that's now called the Data Documentation Initiative Alliance, DDI. And DDI is a standard for metadata. It's a standard in XML. For those of you who don't know what XML is, you probably have seen HTML, which is these tags of things that make things show up in your web browser. Well, XML is just a variant of that. And DDI is an XML standard for marking up a code book describing a data set. So behind all our stuff, we save things in this format. And we're now building various services online that take advantage of that. So for one thing, when you get a PDF codebook from ICPSR, that PDF codebook was actually rendered from the XML, not the other way around. So we first do the XML, and then we have a program that just makes a codebook from it. We also are more and more making our codebooks interactive and available online. And because we mark up data at the variable level, we're developing services that take advantage of this detailed metadata. So we have, on our website, you'll actually see two ways to search. One called Find Data, and one called Search and Compare Variables. This is the Search and Compare Variables. And this is actually searching at the variable level over 4 million variables in about 4,000 different data collections. The average data set at ICPSR, by the way, has 400 variables in it. So we're talking about interviews with people, some of which can take a couple hours, or there could be multiple interviews. So one of our data sets we distribute is the General Social Survey, and they actually distribute all of the. This is a survey that's done, I think, every 2 years. Has been since 1972. They put all of the answers in one file, which has something on the order of 50,000 variables in it. So, even finding within those variables. So now we have a way that you can search at the variable level. And what you can do is do a search like this, where you're looking for a certain question. And you get a list of results. And then the results come with checkboxes. If you click on some of those checkboxes and then click on the compare button, you get a display that looks like this, where it compares the variables side by side, like shopping for backpacks or refrigerators or TVs at Amazon. And so you can see here, what data set the variable came from. If we know what question was asked, the text of the question here is here, how many yeses, how many nos, and so on. There's more information down here below the fold, but this tells you the time period in which it was asked. And a lot of this stuff is live. So if you click here, you actually get to the landing page for that data set. So we see this as a different way for people to get into the data. In fact, I've been advocating that instead of calling this search and compare variables, we refer to it as our question bank. Because one use of this is people who want to develop a new survey can come to us and look at old surveys to see what questions were used, what was the distribution of answers in those questions, and so on. Another service we have that is on the website, but I haven't yet discovered a great way to get people to understand it, is that you can now, if you search on our other search page, which we refer to as our study search, that is, it searches for collections, not for variables, you can actually find studies that have 1, 2, 3, 4 or more variables in interest. So in this case, suppose you said, to do the regression equation I want to do, I need to know whether parents volunteer in school, whether the family reads a newspaper, whether the family volunteers in political activities. So this search, which we call our variable relevance search, actually is searching for variables here, and they're grouped by study. And under each study, there's a column for each variable. And the variables are separated here by commas. Interestingly enough, this was a survey in Texas in 2004. So this is another way of finding the data where you can ask a question, which data set has these 3 variables? And we're developing ways to answer questions like that. Now, Ken also mentioned the OSTP memo about sharing data, and we've been working on that for a long time. This is our guide to preparing data for deposit at ICPSR and archiving. It has a lot of information in it. It's actually available now online because we decided that it was changing too fast to stick with only the printed version. But this is the 5th edition. I think the first edition was about 1980. And it's used by many people as a guide to how to prepare data. At the beginning of a project, it even has advice about how to write your informed consent so that the data can be shared afterwards. We also, when the National Science Foundation came up with its requirement that PIs have to have a data management plan with each proposal, we created a guide to writing data management plans. And if you go to this page, you'll find a lot of resources about what is a data management plan, how do you write it, and if you're intending to distribute the data through ICPSR, it tells you what we do, and you can write to us, and we will actually give you a letter that you can put in your grant saying that we will take the data and distribute it for you after the grant is over. Another thing we do is we do a lot of things to provide people with help in how to do this in SPSS, like this one over here says, reading data into SPSS using a setup file. And we've discovered that rather than giving people long narratives, a video works better. So we have our own YouTube channel, and if you can go there and get help on using SPSS or SAS. Mostly it's about getting the data in, but there are other things. And when we do a function or a webinar, we put the video up there. So let me try to quickly talk to you something about another side of data sharing that is very important, which is if we want people to share data, we've got to give them at least some incentives. And we try to do that in a number of different ways. This is a list of them. Let me go through them quickly. So one of the things that we do is that if you put your data at ICPSR, you can at any time find out how many people are downloaded. So there's a button you can, and anybody can do this. You go to any study there, it says download statistics, and you can do this. And so this is for this data set, how many people downloaded in the previous year, or you can reset the timing to go all the way back and so on. This is a second page. We actually show you which are the main institutions where it's been downloaded. Another thing that we do is that we collect, we have a librarian whose job it is to go out into the journal literature and look for articles that have used data at ICPSR, and then we put them up on our website in a bibliography. And we currently have more than 60,000 of those links. So on our website, you can actually search publications first and then find the data that go with them. Although I think the most useful part of it is if you find a data set that you want to use, that data set is linked to a bunch of publications, and you can find out what other people have done, with that data set. So we think that. But again, showing people the citations that have been created from their data is an important thing for them. So this is one of these pages. So this is a publication, and here's the data set that it was based on. So just another word about the bibliography. The big problem, the reason we have a full FTE devoted to creating the bibliography is that the journals do such a terrible job of citing data. Journals, and I know it's true in most biomedical sciences and certainly in the social sciences, journals do not treat a data set the way they treat a publication. If they treated a data set like a publication and put it in their references section, then Thomson Reuters and Google Scholar would already find all these connections for us, and we wouldn't have to do it ourselves. They're not doing that now. This is something that I've been working on, but we still have a long way to go there, and the real problem is at the journals level. It's not even the publisher's level. It's mostly the editors. Okay, so another big part of what we do is educational resources, and we have several different kinds of those. The one that is best known is our summer program in quantitative methods, which for the last 3 years has had more than 1,000 participants. We're going to have close to 90 different courses this coming summer. We have both 4-week courses and 3 to 5 day courses. All of them are very intense. The 4-week courses, really, people can take a full semester of statistics in 4 weeks. But there's also all sorts of other topics about things that they can use. The 4-week program has lots of benefits. People don't just take these statistics courses. We have lectures. You can learn about SAS, SPSS, R, Python, all sorts of things in additional lectures. This is a little bit about the size of the program. And then another thing that we've been working on is providing resources for instructors teaching undergraduates so that they can use exercises with undergraduates to teach them about quantitative methods. And so what we have are what we call data-driven learning guides. This is one that's based on the National Election Study from 2012. And it has a set of questions and exercises and a sort of stripped-down data set so that undergraduates can do things, do this themselves. And most of the analysis is in cross-tabulation tables, which an undergraduate can understand. So the goal here is actually not for teaching statistics. It's actually to get instructors to integrate data analysis into the introductory courses so that students really see how the social sciences work. And that's where I'll stop. I've tried to save a few minutes for questions. Thank you.
Okay, well, thank you, George. That was a very nice overview. So we have some time for questions, comments. And the data sharing stuff for, again, those of us in the health sciences and the biomedical world is something that's, I think, fairly new, but it definitely is coming. So we're going to be hearing more and more about this. And the ICPSR is a wonderful resource. And we're trying to work with them and begin doing that with the large data stuff that we're involved in. So questions, comments?
For citations for data sets or whatever, I mean, even so, if the editors aren't requiring it, I wouldn't know how to suggest they put a link to the data set I'm using in their public.
Okay, so it's easy.
Oh.
So first of all of our data sets on the landing page show the citation. So we put it up there. You can
It's a number or just the whole name? And
No, it's a whole citation. So what does a citation consist of? It consists of an author, a title, a date, and a location. On our website, it shows that. You can also push a button and download it directly into EndNote or RefWorks, so you can put it in things. Now, the key thing, though, that's developing in this world is the use of persistent identifiers. Have you ever, I'm sure that most of you don't actually go to the library anymore. But have you ever done a search in maybe Google Scholar or the Web of Science, and you find something that on there, and my guess is that UT has this thing where you can push a button and it goes directly to the full text. So the way that works is that the article has associated with it a persistent identifier of a type that's called a data object identifier, or DOI. And you don't see it on the screen, but it's in the HTML underneath that. And when you click on that, there is a service that resolves that DOI, and that service recognizes that you're coming from UTMB and knows whether UTMB has a subscription to that journal. And if it has a subscription, it automatically transfers you to the full text. Well, we're using the same thing for data. So every data set at ICPSR gets a DOI, and what we want journals to do is to put the citation in their bibliography with the DOI, and then actually if you look at it online, you'd be able to click on the DOI and it would take you directly to the data set at ICPSR. And I mean, if you use the Thomson Reuters data citation index, you have to pay extra for that. We transfer all of our bibliography to Thomson Reuters so that people can discover it, and you can, the same way you can go from Web of Science to an article, you can go from Web of Science to a data set. So the technology is there. It's not hard. The hard part is the people part, about getting authors and editors to make sure that the citation is in there. If we could get all the journals to use citations and use DOIs, our librarian who does the bibliography could move on to something more interesting.
Okay, well, thank you again.
Thank you.